Good morning.
Good morning.
Good morning, everyone. Just as a reminder, if you guys could just put your name and organization in the chat so we can keep track of attendance, that would be lovely. Morning, Jamal.
Good morning.
Looks like there wasn't an option to turn our videos on this morning, which was strange.
Really?
Let me see if it works now.
Yeah, maybe it
Oh,
just needed the
turns out
host
it
of the
does.
meeting to join.
You have the almighty power.
I'm empowered by the 49ers always.
Well, good morning for the rest of you who are joining us. Just a reminder, if you could put your name and organization in the chat, that'll help Jamal keep track of attendance. Make sure we have a voting quorum present.
All right, Jill, I'll go ahead and bring up the slides here.
Thank you, Jamal.
Hey, Lisa. Good morning.
Good morning.
So Allie's joined. Hey, Allie. And Annie Willems and Chris Barber.
Good
to
morning.
you both.
I'm not so sure about those 49ers, but okay.
Oh, come on, Chris.
I'm from Pittsburgh. 2 Super Bowls I went to.
Wow, that's dedication. I'm glad I wasn't at the 49ers Super Bowl. It's their latest ones. That would have been heartbreaking. Okay. I see Bruce is joined. Good morning, Bruce.
Good morning.
And Phil and Prashanthi. Good morning to you both. And Ryan.
Good morning.
Welcome all. And if you didn't get the message early on, as folks are kind of joining here, please put your name and organization in the chat, and we'll make sure we've got a voting quorum today. See, Abby's joined from Sandy Am. Welcome. Glad to have you sitting in today. Brittany. Good morning, Brittany. And Christina. Welcome. Okay, Jill, I think we've got a good crew to get started here. I'll continue to look for that voting quorum. I think we're getting close. So, but in the meantime, I think you're good to get started.
Okay, so if we want to jump in and just invite any member announcements, that would be great. Anybody have anything they'd like to share?
And while folks are thinking about it, I did just want to say briefly some bittersweet news for CAP. Bhavesh Rajani has taken on a new role at another CCO. And so Really just wanted to say, can't thank Bhavesh enough for his wisdom over the years that he's shared with us, both from a clinical perspective and also from the CCO perspective. We're going to miss his insights here, but we will keep everybody posted as we learn more from Pacific Source on his replacement. So stay tuned for that.
Thanks, Jamal, for that update. Anybody want to share anything else? If
And
not, we can open it up for any public comment.
And really quick, Jill, I do see somebody in the chat with a K572177 name. Can that person announce themselves? We're taking attendance at the same time here.
Hey, Jamal, did you announce our open house at all yet?
We did send that out in the meeting minutes, but it's a great reminder. What is that, Wednesday next week?
April 2nd from 4 to 6 p.m. We're inviting all of our board and committee members and other community partners to come see our new office space in Southeast Salem at 1701 Liberty Street. We'll have yummy food and drinks and hope to see you all there.
Thanks, JC.
I'll introduce myself, Alicia Dr. On. I am the Medicaid and Medicare director for Kaiser Permanente Northwest. So I haven't attended this, and Carolyn King-Woodall, one of our great physicians, has been moving a bit away from leadership. So I'm filling in while we're waiting for another physician to step into that role.
Great, thank you, Alicia. And Jill, looking at our attendance today, we do have a voting quorum.
Perfect. Great. Welcome, everybody. Just like to open it up one more time for public comments, see if there's anyone else who'd like to share anything with the group. And then if not, we can go ahead and move on. Jamal, maybe if you have time to share the doodle poll results.
Yeah, not necessarily the doodle poll results. We're still waiting for folks to indicate their availability for an in-person networking event. So this is part of our emphasis on bringing folks together through CAP and creating more of a space for this group to network together and share ideas. And so starting place for that is figuring out a time where we can all be in the same place at the same time. So I'm going to post that doodle poll in the chat. When you get a moment, please fill out the poll on what day and time could work best for you, and we will get that scheduled. So I'll go ahead and get that posted in the chat in just a moment. Jill, I think we can move forward in the meantime.
Sounds good. Thanks, Jamal. We'll go ahead and move on to the next topic, which is the 2025 Clinical Advisory Panel Charter. Lisa, if you want to take it away.
Yeah, so what we have for the group this morning is the 2025 CAP charter that was sent out earlier. This slide right here focuses and highlights the key changes, which are helpful in membership with regards to, in addition to 2 co-chairs, adding that CAP may be chaired by a single chairperson, so some more flexibility in the membership there. Additionally, in section 3.1, subsection 5, we have added language of newly appointed members may have health-related experience in a clinic community setting instead of solely direct healthcare service delivery experience. And then section 8.5 or 8.1, the subcommittee, that modification allows for dual leadership potentially with Pacific Source Willamette Health Council, specifically with the co-chair of the member access, and as a result of recommendations from the Access to Care report recommendations. And lastly, section 9, moving us from the 2024 priority areas to the 2025 CAP priorities. So opening that up to the group, any comments, questions? And if nothing there, looking for a motion to adopt the changes.
I vote to adopt.
Thank you.
I second.
Thank you. All in favor? Any opposed? Any extension? Okay, thank you. Next. Jill and Jamal, the Social Care Impact Fund follow-up.
Hey, thanks, Lisa. So Jamal had sent out summary points and slides for everybody to review. I think at the last meeting, we all kind of come away with requesting a little bit more detailed information. So you all should have had time to kind of review the slides and the allocation of funds, the process, etc. So I just wanted to make sure we had time to open it up for any questions or comments after having time to review the information. I know that Jamal had taken some questions via email and shed some light on some further details. We are looking for a motion to approve moving forward with this process plan.
Yeah, thanks, Jill. Just a few more, a little bit more context. So once again, these are quality incentive pool dollars from 2023 tied to the social needs screening and referral metric, as well as the social and emotional health aspects of kindergarten readiness. The board has allocated, the council's board has allocated these funds to CAP to determine a process for equitably driving these funds into community initiatives that impact our region's ability to perform well on these metrics and create more capacity and sustain capacity around social needs screening and connecting kiddos to behavioral health services. So great opportunity here for CAP to sort of spearhead additional investment into our community partners and providers who are providing these important services to CCO members.
Can I jump in, Jamal?
Yes.
And also last CAP meeting, there was the request to talk about this further rather than to just move it through a vote either outside or approval outside. So this is really an opportunity and us demonstrating that we heard that there was the potential of wanting more conversation around this, but maybe enough has been presented and we're in a place of clarity to move it forward with the group.
And the next slide as well, just it does give a little bit more around the implementation process. So one of the things to note here is a timeline is really dependent upon CAP's approval, of course. If approved at this meeting, we will look for an application window to open for the community for about 5 to 6 weeks. Hopefully we can get that opened in April with evaluations beginning by our Health Innovations and Investments Work Group following that 5 to 6 week window. So that would potentially place us in May or early June for the work group to evaluate those applications. And then hopefully we can get awards out to the community in sort of that June or early July timeframe. This would be a process that involves pretty wide-ranging communications to the community at large, announcing the funding opportunity, including hosting a webinar. So our grant management team, Melissa Lindley and Allie, have hosted webinars like this for other grant opportunities through the council. And so that's another opportunity for the community to learn about the opportunity, come and ask questions as they're considering applying. And then as the process shows here, we would move into evaluation of applications after that window closes through the work group, kicking out the council's notice of awards for those entities that the work group decides have met the criteria for the award, and then ultimately helping those organizations to kick off their projects once we've got signed letters of agreement from the group. So we'll pause there and open it up for any discussions, questions, or if the group is ready to move this process forward.
So this is Manu. Just wanted to say thank you for kind of taking us back and kind of adding more, sorry for lack of a better word, I'm vegetarian, but adding more meat on the bones, you could say, with this. And so that makes me feel better about the process. I think the only comment that I would want to make for those who are part of the committee is that, you know, there's a lot of opportunity, or there's a lot of need in the community. And so I would like to ensure that these types of funds really go as upstream as possible in order to have the greatest downstream impact. So more than happy to review with whomever is on the committee kind of my thoughts about it. But again, I appreciate adding more meat on the bones to what was originally reviewed at the last meeting. And I can formally provide a motion if that's needed for approval.
Great, thank Manu. Does anybody else want a second?
I'll second.
Perfect, thank you. All in favor?
Aye.
Aye.
Aye. Aye.
Anyone opposed? Perfect. I think we can go ahead and move forward, Jamal.
Oh, Jill, we should ask if there are any abstentions as well.
Oh, any abstentions? Thank you. Perfect.
All right. So with that, we'll certainly work with our Health Innovations and Investments work group and our grant management team to move this process forward, stand up the application process. And Manu, I think it'd be great as well to circle back and talk a little bit more about how best we take that upstream approach. So look for some follow-up as well, just to kind of talk that through offline. Okay. So I think the next one here is for me to talk through on the agenda, Jill and Lisa. So I'll kind of jump in here. So one of the really cool aspects that CAP members have sort of indicated is important to them in late 2024 was sort of our ability to leverage this group's collective influence to advocate for policy changes, operational changes within the Marion Polk community or at the state level that can ultimately improve community health, improve CCO members' health outcomes, community health outcomes, and the experience of care for our members. And so we took that offline and developed a process for any CAP member, really any Health Council committee member, to state what those policy changes or operational changes could be, and what would make a difference in our community for us as a body to review and consider supporting as a group. So as you'll see in your meeting materials, the policy advocacy request template is now available. So this is a fillable form that folks can fill out, and I'll kind switch over to the actual form in a moment so we can kind of walk through that. But this is available now for CAP members. So if there are changes that you'd like to see in state health policy, in local policy or guidance that you feel could improve community health, this is a great opportunity to use this form to send into your co-chairs and myself for consideration and how we collectively support those changes. So this, a couple things to note. These requests must align with WHC's mission, vision, and values. So that mission being that we're improving the health of the Marion Polk community through governance of our local CCO, investing in our communities and fostering collaborative relationships. Ultimate vision here is that that we've got optimal health and well-being for Marion Polk community members. Our values are that we work in service to Oregon Health Plan members in the communities of Marion County and Polk County. We are transparent, collaborative, equitable, accountable, adaptable, and strategic. So as you and your entity or your organization, or as just a community member, as you consider bringing forth policy or operational changes, what would happen is the council will then review and determine alignment of that request with that mission, vision, and values. Understanding that there may be a number of requests that come in, we may prioritize advocacy efforts and sort of the work behind this with those requests that align with our upcoming community health improvement plan and the priority areas laid out within the community health improvement plan development, which are addressing housing stability, mental health and substance use services, mental health and substance use, substance abuse, and access to care are the three priority areas. So just something to consider as folks are submitting requests. Any ties that you can make into the upcoming 5-year community health improvement plan may receive additional priority. As requests come in and sort of go through the process to be determined as something that the council and CAP would like to move forward in consideration, we may ask that the requester present that policy or operational change to CAP and potentially other committees, with the goal being not just that it's creating awareness, but that it has potential to gain support, official support from council committees such as CAP. And then potentially if CAP is officially in support, there could be a request for individual organizations to support a request and requesting what it would take for your organization to sort of put your name and logo on a more official white paper that we would develop in partnership. Before I pull up the actual policy advocacy request template here, I wanted to pause there for a moment and just see if there are any questions, comments, thoughts on this process and what it's intended to do here. I do see that Dr. Chowdhury, you've got your hand up. Go ahead.
Yeah, I had a question. So who has the ultimate authority to promote this? While it reads as though that the CAP and other committees can maybe promote it, but who's the ultimate grantor of the policy or of advocacy toward any state or local policy?
Yeah, that's a great question. So ultimately, council leadership, under guidance from our board of directors will be determining, whether we decide as a council to advocate or support or move forward with presenting a certain requests that come in. Part of that process, as requests come in, is sort of that initial step of our council leadership reviewing really to determine if the request that's come in meets the requirements of the intent for this process, as well as all of our really alignment with our mission, vision, values. From there, a committee manager like myself or other committee managers will work with the requester to review the accuracy of the request and confirm with the requester and other partners, sort of the claims that are being made within that template, before ultimately, and through that process, there may be sort of a back and forth with the requester around any needed updates or changes or modifications before it's ultimately brought forward to a committee such as CAP to review. But to answer your question plainly, our council leadership is ultimately going to make the decision on whether the request is in alignment with our organization.
Okay, just to clarify a little bit further, so I interpret that the board of directors and the ED will make the ultimate decision whether WHC provides any type of policy advocacy, correct?
Yeah, I would, sorry, Jamal, I'm gonna just jump in for a second. It's Josie. I would add just a clarifying point here. This is really specific to policy advocacy requests where the Health Council is being asked to leverage time and resources to help organize folks around some sort of change. We're asked all the time to sign off on different efforts, and those are things that we review internally, depending on how big the policy advocacy ask is, we'll bring those requests to our board as well. But this process is really specific to things that committee members are bringing forward where they're asking the Health Council to take some kind of active role to organize and resource an effort. And again, that internal review will start with Justin and myself, and then depending on how big the item is, we might need to engage our board as well. So I don't know if that helps further clarify.
Yeah, I think that does, and I was really just looking at from a governance structure. What is, we're each of us around the table, while we represent the CAP, I think we're ultimately stewards of the Willamette Health Council,
Yep.
So I just want to make sure that everything's is tying out together. So thank you for
You bet.
allowing me to go down that rabbit hole with
You bet. And Jamal, forgive me if you already mentioned this, but this process is going to be opened up to all of our committees. So we're doing the work right now of sort of socializing it and getting some feedback. But points well taken. Thanks, Manu.
Yeah, great questions, Manu. Questions from others, or I'm interested if folks have any thoughts around need for policy advocacy. Does anything sort of come to the front of mind for folks that you might want to see considered through this process? Lisa, go ahead.
Thank you. I just want to, first of all, say thank you for this. I'm really excited of having this as an opportunity to take issues that are apparent within our communities and have a structure about how to bring that forward in a policy manner. So I just want to say thank you for that. And you're right, Josie, to your experience, I personally have been someone that has brought to, hey, can the council help with this? And I just think having this structure and a path forward that's mindful just is really accelerating what we can do as a community to bring forward change. to more of a comment.
Thanks, Lisa. And just a quick aside, I have posted the doodle poll to the CAP networking event scheduling poll in the chat. So if folks could take a moment to complete that poll, we would appreciate it. And Lisa and Jill, would you like me to walk through the template, or would you like to give some folks some time offline to review?
I think it's pretty brief and we have time, if you don't mind just walking through, that would be helpful probably.
Yeah, certainly. Okay. Just a moment here. Okay, let me know when you can see my screen. Good to go? Okay. All right, so so up here is sort of the instructions for requesters, so I won't belabor the point and rehash all of that. Folks can kind of read through that on your own time. If you do complete this form, go ahead and submit to myself as well as Jill and Lisa as your co-chairs. And we'll make sure that's sort of routed through the correct process that we outlined. At the top level here, we'd ask that you provide a concise descriptive title for the policy change, your name and organization. Starting with the first area, we're asking folks to lay out what's the problem statement, what's the issue that's being addressed, or what's the opportunity that a policy change or operational change can sort of take advantage of. So initially we just had it at problem statement, but we thought probably be good to address opportunities that come up in the community as well. The next section is what's the proposed policy change? So asking our partners to really clearly outline the recommended policy change or solution, as well as any, if there are examples of similar policies that have worked well in other locales or in other states even, or even other countries, I suppose. Examples would be helpful, but really just asking folks to clearly lay out what is the policy or operational change that is needed or requested. And then what are the relevant timeframes? So if it is something that the council and CAP we're going to collectively utilize our influence and leverage to advocate for, what are the relevant timeframes? Are there deadlines? When does advocacy become less effective versus more effective? For example, maybe there's something that will be going in front of the healthcare subcommittee at the legislature in 2 weeks. So just asking folks to indicate any sort of relevant timeframes for any ensuing advocacy effort. If everything goes well, what's the expected outcome? So what's the impact of that policy change? How would we expect to see CCO members' health outcomes improving, or their experience of care improving, or the efficiency of care within our communities improving? So we'd ask folks to really clearly lay out the expected outcome there. Last two, so the call to action. So this is where we're asking folks to indicate what's that specific what specific authority are you looking for to take action? So is this a statute change that would be needed through a law that would need to go in front of the legislature and ultimately to the governor's office or the governor's desk for signature? Is it a rule change that, perhaps advocacy with OHA's, director could um, invoke the necessary rule change that's needed to improve what the request is advocating for, et cetera, et cetera. So really kind of being clear about who do you need to make what decision, right? And then lastly, if there are relevant statutes, organ administrative rules, policy guidance documents, or legal resources, asking folks to put that information in here. So if there's a, organ administrative rule, for FQHCs under the Medicaid plan that folks want to see changed, looking for folks to cite what that specific rule language is and what the proposed change would be to the rule. And that's essentially what the policy advocacy request template is. I will say as well, if we do get to the point where requests come in and it gathers sort of a critical mass of support from the council and other CAP members and organizations and CAP as a whole, we would use this template as sort of a starting point. But ultimately, we would work with, or we can work with the council's communications team to turn this into a more formalized sort of white paper. Other advocacy efforts and activities could include co-presenting with the requester in front of other outside bodies, whether it's OHA, the legislature, other health leaders across the state. It could include attending certain meetings, communicating out to the community around the need. I think it's really open to CAP to decide, if there are requests that are impactful for our community. Not just that we'll sort of support it collectively, but how we want to support it. We can sort of talk through those elements as well. I'll pause there for any questions on the template or other thoughts. I see there's something in the chat here. Dr. An, appreciate being here. Thanks for joining. Okay.
I think this looks great, Jamal. It's very well set out and laid out and very easy to fill in. Thanks for putting that together.
Awesome. Excited for it. Excited to see what the community comes forward with. Okay, I'll go back to the slide deck here. Okay, back to you. Lisa, did you want to close this out?
Yeah, so sorry about that. I was trying to click my unmute. Okay, so thank you all. Thank you again, Jamal, for presenting, and Jill as well. In summary, just to recap, there's the upcoming open house, April 2nd, 4 to 6 at the new Liberty Street location. Hope to see you all there. We are saddened to hear about Bhavesh's departure, but we'll await Pacific Source of announcing his replacement. Again, Jamal put in the chat the networking event that we're seeking your input so that we can get that coordinated. We thank you for the approval of the CAP charter as well as the social care impact funds to move that forward. And the template for bringing things forward in, oh my goodness, I'm losing my words here, an advisory
Policy
political
advocacy.
policy advocacy.
Yeah.
So I think that's all that we have for today.
Yeah, one other thing, Lisa, just a quick update on impacts, the Marion Polk Action to Care Subcommittee that was approved at our last CAP meeting.
Yes.
So we have communicated out to the community that we are recruiting members for participation on that subcommittee. We've had an outpouring of support and excitement for that kickoff, which is on April 11th at noon. So we're going to have a hybrid virtual in-person kickoff. So that's really to drive forward in rapid motion the access to care improvements that you all have reviewed and have graciously approved to sort of be shepherded through that subcommittee. We're still we've got I believe about 25 organizations represented on that subcommittee. Folks from WVP and the Willamette Workforce Partnership, CTEC, the CTEC training program through the school district, as well as colleges and universities. So Chemeketa's both behavioral health and medical training programs, as well as Western Oregon University, Willamette University, several pediatric and primary care practices across the region. Both counties are represented on impacts. So a wide range of voices to help inform how we rapidly drive those investments into the community. So very excited for that kickoff on April 11th. And if any of you all would like to join, there's still more room. So please reach out.
Thank you, Jamal. Well, with that, it looks like we've reached all of our agenda and updates and next steps. And we are going to get a little bit of time back, unless there's any comments or additional discussion.
Never seen this happen with CAP. This is new territory.
Time to fill out that doodle poll then, folks. You've got 20 minutes to give us your feedback. Okay, with that, we thank you all and have a great rest of your day and rest of your week. Thank you for all that you do in our community. We appreciate you.
Thank you.
Thank you.
Thanks.
Take care.
Bye.
Bye,
Thank you.
everyone.
Bye.